This presentation is about overcrowding in the emergency department by Kalia Choquette. Overcrowding in the emergency department occurs when ER rooms are at capacity and are unable to meet the needs of the next patient. This can occur when there is an increased volume of patients, but also when an ER is faced with boarding patients. Boarding can be defined as holding admitted patients in the ER, usually due to a lack of bed availability within the hospital. During my research, it was found that the average number of ED visits increases by 3.5% each year. The American Hospital Association reported that 38% of emergency departments are performing at or beyond capacity. Those two issues work against each other and drive the subject of overcrowding in the ER into an even bigger problem. Research also showed that it is not uncommon for EDs to only be able to utilize within 50% of their building capacity due to boarding patients in the department. Lack of inpatient beds are a key factor in ED overcrowding. Overcrowding in the emergency department has been shown to increase risks for patients and have negative impacts. These risks include longer wait times, which can delay emergency care being given to patients quickly or cause patients to leave without being seen. Increased length of stay, which contributes to the overcrowding issue, as well as increased medical errors from staff. In an overcrowded state, ED staff cannot provide adequate patient care or provide treatments and medication administrations in a timely manner, which ultimately leads to a decreased quality of care and patient safety. If a patient is in critical condition, these delays of treatments can create an increased risk of patient mortality. One other negative outcome of overcrowding is that it can create a poor experience for the patient, as they are forced to remain in the ED waiting room in various states of discomfort and possibly leave without being seen. Not only are there risks to patients, but staff working in the emergency department also feel the negative impact of overcrowding. ED staff not only take care of the patients that present to the emergency department, but they also must provide cares to those patients who are being admitted and boarded in the ER. This can be extremely difficult and stressful when having to provide life-saving measures to critical ER patients. Research shows that ED overcrowding is associated with higher staff turnover and staff burnout. It can also lead to an increase in human error due to increased staff distraction and stress. According to an article by Wolf et al., maintaining ED morale among nursing is paramount. Burnout and poor morale lead to nurse callouts, often leaving holes in the schedule and forcing nurses to become inefficient and overextended, or further decreasing the functional size of the department by needing to close the ED beds. Unfortunately, it is hard to close ER beds, so departments are forced to work short-staffed, in return worsening the burnout. I've personally witnessed the burnout and stress that boarding patients and increased emergency department patients can cause. In the emergency department that I work at, we have been fortunate to not hold admissions very often. However, in the past 2 months, that has increased significantly. This is now occurring a few times a week, and staff can feel the burden and stress. The overcrowding is not only caused by the expected increase due to illnesses that come with the fall and winter months, but the facility has also hired a new cardiothoracic surgeon that has increased the amount of cardiac surgeries significantly, utilizing more inpatient beds. We only have 6 ER beds and 1 trauma bay, and we are expected to hold up to 4 admissions if needed. This can be extremely difficult, especially when our own ER patient numbers have increased. We also only staff with 2 or 3 nurses at one time, so having extra duties on top of working with a decreased amount of space can be very chaotic and stressful. Not only do we feel overwhelmed from the overcrowding, but our department is short-staffed, so many of us are working overtime, which again only increases the risk of staff burnout and fatigue. According to Lindern and Wojtak, issues that result in ED overcrowding can be broken down into 3 sections: input, flow, and output. Input includes the number of patients arriving to the ER to be seen. Having a higher census increases the chance of overcrowding. The second issue is flow. This involves the treatment plan of each patient. The higher acuity of the patient, the increased amount of time it can take to treat the patient. A delay in laboratory and radiology testing and resulting can slow down the flow of the department, which could then increase the amount of patients at one time. The third issue is output. This involves getting patients moved out of the ER in a timely manner. Lack of inpatient bed capacity is a leading cause for longer boarding hours for admitted patients who reside in the emergency department, creating overcrowding. Other areas that affect the output is difficulty giving a report in a timely manner to the admitting nurse and finding somebody to transport the patient in a timely manner. The problem of overcrowding is not a departmental problem, but rather a health system problem. Allotting extra resources to the emergency department can be helpful, however, it will usually not solve the underlying problem. The solution for one hospital may not be the feasible and successful at another hospital, so having a plan that fits each individual healthcare system is important. This can be done by getting hospital leadership involved and establishing clear roles and responsibilities system-wide. This plan should be reviewed and updated periodically to monitor and maintain its effectiveness. Although the overall fix should be systemic, there are small steps that can be put in place to help ensure success. Some areas of improvement include having a transport team who is readily available to assist with transporting admitted patients from the ER to their inpatient bed. Another way is to facilitate an earlier time of day discharge plan for admitted patients. Most often, discharges from the inpatient units occur later in the day, which could cause a backup of newly admitted patients in the ER. Along with this is the issue that nursing homes tend to not accept patients on the weekend, so creating a partnership with local skilled nursing facilities to accept patients on the weekends can help with bed availability in the hospital. One other area to look at is the number of surgical admits on any certain day. Spacing these out can help to decrease the sudden surge of admissions, which then causes overcrowding in the ER. This may mean that procedures need to be extended from being performed just Monday through Friday to also occurring on the weekends. My solution to assisting with overcrowding in the ER is to create an overflow unit to help take admissions from the ER when there is no bed availability in the hospital. This could be done by utilizing up to 4 preoperative beds for boarded patients. This area would not be able to be staffed by current working staff, so finding the staff to take care of those patients could cause a dilemma. This could be counteracted by offering a pay incentive, such as time and a half or double pay for staff to work this newly created unit. One downfall to this is that it could slow down surgical procedures when those beds are no longer available to the preoperative area. Although the operative staff may feel a small burden from this, it would help to even out the burden across the board instead of overwhelming one department and can be eased with communication and positive attitudes. This image shows how the emergency department flow functions at different levels depending on whether they are boarded patients or not. You can see that in the first row, the ER is functioning at goal performance with no boarded patients. As they start holding patients, the flow decreases and the ER function begins to decrease. As hospital census increases to over 90%, the ER is impacted and becomes overwhelmed, and safety and effectiveness decreases substantially. This image replicates the information that Kellen et al. Stated, that the key to a sustainable solution is to realign healthcare financing to allow hospitals to keep inpatient capacity below a critical threshold of 90%. Beyond that, hospital throughput dynamics will inevitably lead to ED overcrowding. Overcrowding in the emergency department is most often caused by a lack of inpatient bed availability and poor patient flow. Overcrowding has been shown to have a negative impact on patient outcomes as well as staff retention. The best way for a hospital to assist with overcrowding is to have a system-wide plan in place and reevaluate that plan periodically to ensure it is effectively working. Here are the references utilized for this presentation. Thank you for listening to this presentation.